afternoon. Myself is Dr. Rakhi Mishra, working as an associate professor in Noida Institute of Engineering and Technology, Pharmacy Institute. So, in this lecture, we will discuss about urinary tract anti-infective agent, that is a part of unit 3rd of your medicinal chemistry. Okay. So, in this lecture, we will discuss about what is urinary tract infection, how it is caused, and what are the different types of you can say symptoms which a patient will suffer. So, basically a urinary tract infection or UTI is an infection which occurs in any part of your urinary system. The urinary system comprises of kidney, one minute. The urinary system comprises of kidney, bladder, ureter and urethra. Okay. So, if we talk about the urinary system of a human body, then the 4 parts or the 4 body organs, 4 body main parts are there which comprises the urinary system. The parts are kidney, bladder, urinary bladder, ureter and urethra. Okay. Now, if we talk about the thing, these are the kidney, okay, okay. This type of structure is there. These are your kidney, these are of ureters, these are the bladder and this is your urethra. Okay. So, if we talk about the urinary or UTI, urinary tract infection, 4 parts of human bodies are there, 2 kidneys, 2 ureters which are related with one kidney, then bladder, and this is your urinary bladder and this is your urethra. Okay. If we talk about the type of urinary tract, then it is, if it is we consider kidney and ureters, they cause the upper urinary tract and the lower urinary tract comprises of bladder and urethra. So, we can divide these 4 parts of our human body into 2 types, means the urinary tract can be divided into 2 types. The one is the upper urinary tract and second is lower urinary tract, means we are talking about urinary tract infection. So, we must be familiar that what is a urinary tract. Urinary tract can be divided into 2 types, the upper urinary tract and the lower urinary tract. Upper urinary tract comprises of, made up of kidneys and ureters, and lower urinary tract is made up of urinary bladder and urethra. A very simple function, if we consider, kidney is causing the reabsorption, filtration, and ultimately what it is causing, kidney is absorbing all the essential ingredient and is passing the unwanted ingredients into the ureter. Through the ureter, it is travelling to the urinary bladder, because in the urinary bladder urine is stored and through urethra it can be passed out. Okay. Now, if any type of infection or if any type of you can say infection occurs while passing that urine, then it may lead to urinary tract infection, because the unhygienic condition or the insanitary conditions can cause the urinary tract infection, right. And because of this, what happens, this bacteria, different types of bacteria, for example E. coli. E. coli is the mainly responsible factor for urinary tract infection. E. coli bacteria, when it goes into your urine, it travel up to your bladder and it causes the urinary tract infection. A very interesting part is ki the you can say the transfer of this bacteria will occur from lower side to upper side, because you are passing your urine from urethra, right. So, this E. coli will enter from your urethra, then it goes into your urinary bladder. It will develop a type of different types of symptoms, the reddening and the irritation, and frequency of urination will increase, and then it can further move to the kidney. Okay. So, different types of urinary tract infection can occur, and if this urinary tract infection can be categorized, if it is occurring in kidney or ureters, it is known as pyelonephritis. This pyelonephritis is not a very common UTI, because the E. coli or the causative agent have to move from your bladder to the kidney, from lower to upper side of your body. But when this type of infection occurs in kidney and ureters, this is pyelonephritis, and if it occurs in the lower part of this infection, can be caused as cystitis or other type of infection. So, the thing is ki the upper urinary tract and lower urinary tract is there, but the infection can proceed from lower urinary tract to upper urinary tract, and normally what have been observed ki the people with lower urinary tract infection are more when we compare to urinary tract infection of the upper urinary tract. Okay. So, now moving to our slide, a urinary tract infection or UTI is an infection in any part of urinary system. We have already discussed it can occur in kidney, bladder, ureter and urethra. It is when bacteria gets into your urine and travels up to your bladder. I have told you ki from the lower side to the upper side it will move. Okay. This UTI cause more than 8.1 million visit to healthcare providers, because in the whole lifetime of a single individual, it is not so that he will not suffer from UTI, because you are maintaining the hygiene and you are maintaining all the sanitary condition, but if you go to an outside place, maybe the infection you can prone that infection from there only. Okay. So, nearly 8.1 million people visit to healthcare providers each year. That means the ratio is each year about 8.1 million people are suffering from UTI, among which 60% of women and 12% of men will have at least one UTI during their lifetime. As we have already discussed that in the lifetime, if we consider, then about 60% of women and 12% of men will have at least one UTI, urinary tract infection, in their whole lifetime. The symptoms of urinary tract infection, I have told you ki it proceeds from urethra to urinary bladder and then from ureters and kidney. The lining of the bladder and urethra becomes red, irritation can occur as your throat does when you have a cold, right. Irritation can be a symptoms. The irritation can also cause a pain in your lower abdomen, pelvic area. This is a very common symptom which a woman faces in whole of his life. Many times women complain that we have a lower abdominal pain. So, the cause can be a UTI, and even it can move towards the lower back and will usually make you feel like urinating more often. This is one of the very prone, one major symptom is that you may have a feeling that you want to urinate, but when you go for urination you will not pass, it is not possible for you to pass your urine. So, what you feel? You feel that you have a urinating feeling many times, but it is not so, you are not able to pass that urine. So, that is a main symptoms which indicates a person that he is suffering or she is suffering from urinary tract infection. A urinary tract infection is an infection in any part of the urinary system. It is defined as, what is the definition of this urinary tract infection is, it is defined as the presence of at least 1 lakh bacteria per ml of urine. That means, so rapidly they will replicate that in 1 ml of your urine 1 lakh of bacteria is there. Most infection involve the lower urinary tract. I have already discussed. It involves the lower urinary tract involving the bladder and urethra. Is it okay? Okay. We have also discussed this. It is a common disorders at all ages in both males and females. Second most common infection present in community practices. Worldwide, I have told you about 150 million people are diagnosed with UTI. 35% of healthy women suffer symptoms of UTI at some time in their life. Two words are there, healthy women. Maybe the women have the feeling that I am very healthy, but in their lifetime, in her lifetime, maybe she have faced this problem, and the ratio is 35% of healthy women suffers the symptoms of UTI, not the disease of UTI, the symptoms of this UTI at some time in their life. Okay. Now, very important part is how one can treat this UTI infection. In the terms of medicine, it can be treated by these agents. The agents can be divided into bacteriostatic agent, bactericidal agent, urinary antiseptic. The examples of bacteriostatic agents are sulfonamides, tetracycline, nitrofurantoin. Bactericidal agents are fluoroquinolones, cephalosporins, aminoglycosides. The urinary antiseptics are nitrofurantoin, nalidixic acid, methenamine. And see, again, I am again telling you that it is not so that these drugs are used only as, not only as UTI, because we have seen that fluoroquinolone is a very widely used antibiotic, sulfonamide is a widely used antibiotic, right. Methenamine mendiate is also a very widely used antibiotic, but along with their use as an antibiotic, they can be used to treat the bacterial infection which causes the UTI. Okay. So, this is not so that these drugs are having only this action, but they can be used for the you can say cure for the treatment of this UTI. So, the classification are bacteriostatic, bactericidal, urinary antiseptic. Now, one by one according to your syllabus, we will read these drugs. The first drug is nitrofurantoin. The structure of nitrofurantoin, you can see here, it is having a nitro group, it is having an CH double bond N bond, it is having a ketonic group also, right. This nitrofurantoin, it is physically it is a white antibacterial spectrum for both gram positive and gram negative, because it is not so that this UTI is caused only by one bacteria. Species of bacteria are there which are the causative agent for this UTI. They can be in the form of gram positive bacteria, they can be a gram negative bacteria. So, it is used for both gram positive and gram negative bacteria. Okay. It is also active against many strains of E. coli and enterococci. It is mainly used in the treatment of uncomplicated UTI. If the UTI is a simple type, if it is not accompanied by a major problem, then it can be used. The plasma half life is this. You can see in this that this nitrofurantoin is in the form of urinary antiseptic. Okay. Mechanism again is very you can say easy, that this nitrofurantoin is reduced to form intermediates which are very active, and active in the form of destruction of DNA, bacterial DNA. What will happen? This nitrofurantoin is reduced to different intermediates which are very active form, and they act on ribosomes to cause the destruction of ribosomal, or you can say DNA, bacterial DNA. The mechanism of nitrofurantoin is, it is unique, it is complex, and it works by damaging bacterial DNA. How it works? It works by damaging bacterial DNA, because its reduced form is highly reactive. What will happen? It will reduce to, this is made possible by rapid reduction of nitrofurantoin inside the bacterial cell by flavoproteins, which will form reactive intermediates that act on ribosomal protein. What will happen? If you take this nitrofurantoin, it is reduced with the help of flavoproteins which are present in bacterial cell to different intermediates which act on ribosomal protein, and by acting on ribosomal protein, what they do? They damage the bacterial DNA. The broad mechanism of this drug likely is responsible for low development of resistance. So, main The main action of this nitrofurantoin is it inhibits the or it damages the bacterial DNA. How? When you administer this drug in the body by the flavoproteins which are already present in the bacterial cell, they are reduced to reactive intermediates, because of which the DNA is destroyed. Now, the next is streptomycin. It is an antibiotic medication which is used to treatment of bacterial infection, which can be tuberculosis and also brucellosis, for Mycobacterium avium complex, Burkholderia infection, plague, tularemia and red bite fever. I have told and discussed many a times that it is not so that this drug is mainly active for only one infection. It can be used for treatment of different types of infection. The infection can be by Mycobacterium tuberculosis, the infection can be wide variety of mycobacteriums which are the causative agent for tuberculosis. The infection can be brucellosis species, the infection against plague, or it can be active against tularemia and it can be against red bite fever. The structure of this streptomycin is this. Mechanism. See, we have seen that the prokaryotes means the bacteria, they are having 70S ribosomal subunit. This 70S ribosomal subunit is made up of 50S and 30S ribosomal subunit. Now, what this drug will do? It will go and bind to the 30S ribosomal subunit. 30S ribosomal subunit of what? Of the bacterial ribosome, and basically to what? To the 16S rRNA and S12 proteins which are present in this 30S ribosomal subunit. Because the 70S ribosomal subunit is made up of 30 and 50S, and it goes and binds to the proteins which are present in the 30S ribosomal subunit. The name of those proteins are 16S and S12, yeah, 12S. Okay. Now, what will happen? This agent, if it goes and binds to this 30S ribosomal subunit, then what will happen? It will interfere with the assembly of initiation complex between mRNA and bacterial ribosome, because, just wait a minute, it will interfere with the assembly of initiation complex which will form by mRNA and bacterial ribosome. How? Because mRNA and ribosomes, this mRNA will go to ribosomes with the help of mRNA ribosomal transferase. Okay. Now, what it is doing? It is going and binding with this ribosome. If it occupy this ribosome, what will happen? This mRNA, if it comes, it will not be able to bind with this ribosomes, and if this happens ki the binding of mRNA and bacterial ribosomes will not occur, what will happen? Protein synthesis will be interfered, and if this protein synthesis will be interfered, the bacteria can die. So, this is the mechanism. The main mechanism is streptomycin goes and binds to the 30S ribosomal subunit, right. 50 and 30S, it goes and binds with this 30S ribosomal subunit to basically 16S and 12S protein. Now, because it is here, so it is not allowing the mRNA to come and bind with this on ribosomes, okay, in this form, so that the protein synthesis cannot take place, and because the protein synthesis is interfered, the bacteria will die. Is it okay? Okay. The last drug which is there in this lecture is capreomycin. Capreomycin is again an antibiotic which is given in combination with other antibiotics for the treatment of tuberculosis. It is a second line treatment drug for the active drug resistant tuberculosis. Now, all the drugs are given orally, but it is given by injection into a vein or muscles. So, this is the structure of capreomycin. Again, it is acting by inhibiting the synthesis of bacterial proteins. How? The capreomycin exact mechanism is not known, because we have seen, see here, oh sorry, initial slide you can see here, streptomycin is basically binding with 16S and 12S protein, okay. But if we talk about the, and it is binding with 30S ribosomal subunit, but if we talk about the capreomycin, it is observed that it is binding to 70S ribosomal unit, but it is not sure ki to which subunit of this 70S ribosomal subunit this capreomycin is binding. Okay, as we have seen ki in streptomycin it is binding with some specific proteins, but the specificity of those proteins is not observed for the mechanism of this capreomycin. It is inhibiting, it is binding to 70S ribosomal subunit, because of which what will happen, bacterial proteins are not synthesized, and if bacterial proteins are not synthesized, what will happen, the bacterial cell will occur. So, this is about the anti-UTI agents. Again introducing or again revising the thing ki we have seen what is urinary tract infection. Urinary tract infection is anything which is interfering, which is causing an infection in kidney, ureter, urethra and bladder. Okay. The 4 parts of human body, if infection is occurring in these, then it is known as urinary tract infection. If it is occurring in kidney and ureter, it is known as upper urinary tract infection. If it is occurring in urethra and bladder, it is known as lower urinary tract infection. Okay. Infection occurs, or infection you can say move from lower part, lower urinary part to the upper part. Okay. The causative agents can be gram positive and gram negative bacteria like E. coli, or you can say pneumococci, right. And if we talk about the different types, pyelonephritis is a disease which is caused by, if that infection occurs in kidney and ureters, or cystitis or bladder inflammation can also occur. So, these type of infection can occur. If we talk about its prevalence, so we have seen that 60% of women and 12% of men have at least one UTI, urinary tract infection during their lifetime. If we talk about their classification, they can be classified into bacteriostatic, bactericidal, urinary antiseptic. And if we talk about the examples, nitrofurantine, it is active against gram positive and gram negative bacteria, and the mechanism is ki it is converting itself, when it is administered, it is converting itself into the reactive intermediates by the action of flavoproteins, and these flavoproteins are making reactive intermediates, which is basically causing the damaging the bacterial DNA. Okay. Next we have seen streptomycin. Streptomycin is causing different types of treatment of different infections, that can be a tuberculosis infection, other type of infection like plague, tularemia and red bite fever. Then if we talk about the mechanism, it is very specific that it is going and binding to 30S ribosomal subunit, and in the 30S ribosomal subunit it is binding with the 16S and 12S protein. This 16S and 12S proteins are binding with this 30S ribosomal subunit. Okay. Because of which this will interferes with the assembly of initiation complex between RNA and bacterial ribosome, thereby it is inhibiting the initiation of protein synthesis, and if protein is not synthesized, bactericidal action will occur. Okay. Just wait a minute. Okay. Then we have discussed about the capreomycin. It is a second line treatment which is used for active drug resistant tuberculosis. It is given by injection into a vein or muscle, and it is used in combination with other antibiotics for the treatment of tuberculosis. Mechanism is exactly not known, but we know that this is observed that it goes and binds with 70S ribosomal subunit. You can say 70S ribosomes, because of which proteins are not synthesized, and if they are synthesized, abnormal they are in nature, because of which it is very difficult for the survival of bacteria. So, in this way we can classify these type of things. this is all about this lecture. We have talked about the what is UTI infection, what type of UTI infection is there, upper urinary tract, lower urinary tract, and what are the different symptoms like lining of urethra becomes red, irritation, and an urge for urination will be more in patient, and different types of symptoms are there, and because of the those symptoms there are different types of drugs which can be these drugs. Okay. So, this is all about UTI in this lecture. Thank you very much.